I'm Heather Patrick. I'm the CEO of Prevent Blindness Texas, which is an affiliate of the National Organization of Prevent Blindness and a Delta Gamma alumni. I am so excited to be here. I'm excited about this partnership, and I am really excited about our guest today, Dr. Jane Edmond, who is also a Delta Gamma, which we discovered at a Prevent Blindness Texas event, which is one of the reasons I love my job and love Delta Gamma. All right, so let's start today, Dr. Edmond. Um, Off the bat, I want to know how did DG impact you in your college days, but then do you think it influenced you at all in your career choice?
Heather, thank you so much for inviting me, and thanks to Prevent Blindness Texas for all the wonderful things they do. And much of their mission is part of the mission of my medical school, my department, and my personal mission to expand care to the underserved and underinsured. So thank you for having me. So yes, let's see. I was a Delta Gamma, the Beta Eta chapter, back when dinosaurs roamed the earth in the early 80s, and actually the late 70s to early 80s. And yes, I do our philanthropy in blindness and vision impairment was partially influencing me as a pre-med student. But what I think Delta Gamma gave more to me in this way was leadership skills. I was a vice president in charge of Rush my last year, and my ability to gain those skills and have that embellish my resume, I think was very important for me in getting into medical school.
Yeah, I agree. I think that for me too. Obviously, the philanthropic focus meant something to me all these years later. But I agree with you. I think it was the opportunity to find my leadership voice, and that has carried me through too. So
And I
grateful.
have never volunteered in my life until I became a Delta Gamma. Just went to high school in El Paso. Volunteering was not a thing like it is now, or community service.
Yeah.
So that also dipped my toe in the water for volunteerism, and now I've achieved a lot of national positions due to my involvement in volunteerism. So
Awesome. Awesome. All right. So, in discussing a lifetime of healthy vision, we might as well start at the beginning. And I understand that, of course, a child's eye and vision continue to develop throughout their childhood till they're about 18. So, what can parents do? What advice would you give to parents to ensure that their children have healthy vision?
watch for vision or ocular abnormalities that they could report to their provider, their physician. Milestones for vision acquisition. I tell parents at 6, a term baby born after 9 months, a healthy baby, they have vision at birth, but it's very blurry because of the immaturity of the brain and the visual axis. They see light, but they don't really look at you in the face. But the vision starts to develop very quickly. And by 6 weeks of age, a baby will start to smile at their caregiver because it is a social smile. It is imitating the smile that they have learned from their caregiver's face. Yes, it's not gas. When you smile, silent smile at them, and they begin to smile, it is a visually learned phenomenon. So 6 to 8 weeks of age, that should be happening. The eyes will intermittently not be straight in early infancy. That should get better as the vision improves, the visual axis matures. And so by 6 months of age, they should be using their eyes very well, fixating and following on objects far away and up close, and have straight eyes.
So, what about when they get into school? You know, I recently was in a conversation and I shared this out to our group. You know, I have been in so many conversations about people with people that get glasses, and they all talk about the same thing. And it was my experience too. I didn't know I needed glasses until I failed the exam at school. But when I got my glasses, and this is, over 40 years ago, and I still vividly remember the day I could see the leaves on the trees, right? I didn't know that they looked that way, that you could see the individual leaves on the trees. But, kids don't know what they don't know. And if parents, aren't um, keeping up with vision health. So, what would be one or two things you would say as they're school age? What should parents be on the lookout for if they see their kids squinting? Or so, what are some of those things?
So, Heather, I'm older than you, but I had the very same experience when I got my glasses in 5th grade. I'm sure you didn't get cat eye glasses like I was threatened with, but it was at Christmas time, and I actually did not know that the lights on the houses, outside of the Christmas lights on the houses, were discrete bulbs. They were sort of these beautiful halo-ish glows.
Mhm.
So it's great to see leaves, but actually the Christmas lights on the houses looked better without my glasses. Anyway, we have definitely improved since I was a kid and you were a kid, Heather, in terms of not relying on parental observation or relying on children voicing an abnormality that they think is just part of that's normal.
Yeah.
We've now instituted better screening protocols, which are done in the pediatrician's office, the family practitioner's office, that begin at birth, actually. Looking for congenital cataracts or cloudiness of the lens inside the eye misalignment that we talked about, crossed eyes or an eye that drifts out, fixing and following on objects in infancy. But then as soon as the children can get are verbal, hopefully before school starts, visual acuity screening is done in the medical home. Cover one eye, look at a chart down at the end of the room. There's criteria for passing. The youngest kids don't have to see the 20/20 or the smallest line. The 20/40 is good enough. There's a chart within the American Academy of Pediatrics. So we're doing a better job of screening before a kid would complain and before a parent would notice a problem. But if a parent does notice these things, they should see an eye care provider. As you pointed out, nearsighted people like you and me, without my glasses
Yes.
to improve vision at a distance, they squint.
Yeah.
Farsighted children are supposed to be a little bit farsighted at birth, and up until around school age, they're normally a little farsighted. The muscles inside the eyes focus the vision for them, but an abnormal amount or a high amount, moderate or high amount of farsightedness would lead to these symptoms: intermittent crossing of the eyes to try to focus, the eyes cross, or difficulty with near work, like nearsighted is better vision at distance, farsighted is better distance far than near. So a kid who appears to be struggling with near work or has no interest in reading or picture books earlier on before they're verbal, the eye crossing, those would be signs of, I need to see an eye doctor to get this checked out.
Good. All right. So let's say they've had great eye health through their childhood. Now you're into your, the glory days of being in your 20s, early 30s. What should a young adult do to ensure that they are, maintaining vision health?
So fortunately, in the 20s, this is sort of the glory days of your eyeballs. There's very little bad stuff that happens. If you're nearsighted, the nearsightedness, increasing nearsightedness or myopia, that's usually done by 18 or 20. Your nearsightedness is not going to get worse. So your glasses are going to last you for a long, that prescription is going to stay good for a while. Same with farsightedness. lots of the 20, the young adult, 18 to, through college age, they're going to be wearing contact lenses.
Mhm.
Follow those contact lens prescription guidelines, girls, and instructions for care. I've personally seen children come in with using disposable contact lenses that hadn't removed them in months.
Mm.
Terrible corneal infection. So keep up with your contact lens, the guidance on your daily disposable or whatever the frequency of removal, disposal, or cleaning of your contact lenses is, key to eye health throughout an adult a lifetime, but especially in the I'm not sleeping very much age group, staying up late, in a hurry to rush to class kind of thing.
Yeah, awesome. All right, so then we're moving into our 40s, and what starts to happen, and what changes in risk, especially for women.
Right. So there are a lot of organizations that have provided guidance on health eye screening exams in adults, and each one of them are widely different. So I'm just sort of I'll just generalize about when to see an eye provider for a detailed eye exam. So I think most of the organizations recommend at 40 years of age. So what happens at around 40? So at around 40, patients start to become old-sighted. It may not be right then, but it'll happen soon. And that is our parents with reading glasses. Like my mom had a pair in every room. She didn't need it for seeing far away, but she needed it for up close vision. And she bought it from the drugstore. She must have owned 12 pair. So that's called presbyopia. It's from the hardening of the lens inside of our eye, and it gets harder to focus, like your arms aren't long enough to see the object at near. That it starts to happen 40, 45, 50. So it's a good idea to see an eye doctor then. Plus, glaucoma becomes more prevalent around the age of 40. People with a family history of high pressure inside the eye, which is called glaucoma, which causes optic nerve damage, silently damages the optic nerve. Individuals do not know they are losing optic nerve function, visual function, until it's way too late to save the optic nerve. So that means we need to get our eyes checked to make sure we don't have that. If there's a family history of glaucoma, you should be seen starting at about the age of 25 or 30 every 5 years to make sure that it doesn't develop in you. But without a family history, I'd say around 40. And then as we age, it is also still necessary to get our eyes checked because of cataracts. Where I'm from in El Paso, we never, lots of sunshine, lots of UV radiation. We're using mineral oil with betadine in it to get deeper tans, and no sunglasses. So earlier onset of cataracts, so that's UV damage. To screen for that. Also, age-related macular degeneration, which is a degeneration of the central part of the retina that is secondary to aging, or concurrent with aging. It is leads to permanent loss of central vision. So we have two types of vision: peripheral vision and then central vision. So our 20/20 vision comes from central vision, and our side or peripheral vision is from the outer parts of the retina. Macular degeneration occurs in the center part, the most critical part for 20/20 vision. The most common, so according to the World Health Organization, men versus women, women are almost 2 times more likely to be blind in the world. Because in many under lower socioeconomic or developing underdeveloped countries, under-resourced countries, the resources go to the men and not to the women or the children. So women have a much higher incidence of blindness worldwide, but also vision impairment in women is high. It is higher in women than men in the United States. It can be as simple as needing glasses. The leading cause of vision impairment in the United States is needing glasses, simply needing glasses, which is so abhorrent to me, and to anyone who has the means to get glasses, to imagine something as simple as glasses to fix someone's vision so that they can drive and work and see their children or their grandchildren, or participate in activities of daily living. That's where these vision screening programs are really, community vision screening programs are so important, with a provider of, 3D printed glasses that are super cheap. Anyhow, so that's sort of a sideline, but macular degeneration is also more common in women. It is the leading cause of permanent vision impairment in women over the age, in white women over the age of 65 in the US. And it's treated with shots in the eye. Possibly there's dry and wet. Wet macular degeneration. It's shots in the eye every 6 weeks for the remainder, possibly for the remainder of your life. So healthy eating, lots of antioxidants, no smoking, wear sunglasses with UV protection. Those are the best ways we have right now of preventing macular degeneration.
Do you feel strongly, Dr. Edmond, about access for women to get care?
Yes,
Would have never guessed.
I'm sure that passion came through.
It did, and we share it. All right, so let's talk a little bit about the other, piece of, I think, vision loss, especially for the population, aging population, but also diabetes, right? So talk a little bit about that connection too, because we do have the largest aging population and diabetic population in the United States that we've ever had, right? So can you tell us a little bit about what that means for vision?
So going back to US population and the causes of vision impairment, the leading cause of vision impairment in the Black and Hispanic populations is diabetic retinopathy. And that can, diabetes occurs in early childhood or in later adulthood. The formers, typically type 1 diabetes, and these are kids that it's an autoimmune disease. It attacks the pancreas and the islet cells, and they don't make enough insulin. The type 2 diabetes is probably more common, and it is linked to ethnicity, diet, and weight. So obesity is linked to type 2 diabetes. And type 2 diabetes in general, hyperglycemia, too much glucose in the blood, damages the blood vessels so that they leak and then occlude or shut off, leading to lack of blood flow downstream, which is called ischemia, and death of that tissue. So for the retina, or the lining of the back of the eye, the blood vessels, we see them when we dilate the eye, looking into the retina, and we can see the ill effects of diabetes, called diabetic retinopathy, on these blood vessels. And the earliest signs from uncontrolled hyperglycemia, so a diabetic with really good control of their glucose, they may not ever manifest diabetic retinopathy. It's linked to uncontrolled glucose levels. So there's mild, moderate, and severe diabetic retinopathy, and it goes through that stage. You catch it in the mild form, which is just a few hemorrhages inside of the retina, and a few little infarcts or white spots in the retina, that's mild, then it progresses to moderate, and it can progress to severe, which is impending blindness from bleeding of these vessels that are blocked off, abnormal blood vessel growth called neovascularization, which can lead to a retinal detachment, and then could possibly lead to a blinding form of glaucoma. So the key is to have glucose control, but it is pretty amazing how many, and disturbing, how many individuals do not understand the necessity of getting vision or retina screening yearly once they've developed type 2 diabetes and in type 1 diabetes. But the vast majority of these individuals we see going blind are with type 2 diabetes, that they've either not heard their primary care provider talk to them about diabetes, or sort of blocked it out because I just don't want to hear about blindness. I feel like my eyes are fine. You know, patients feel like they should be developing some symptoms of diabetic retinopathy, which you won't have in the early stages when it needs to be treated.
Right.
So I've been in 2 or 3 Uber, you know how you talk to your Uber driver? Probably 2 in the last 6 months who have type 2 diabetes, who haven't had an eye exam, the recommended yearly eye exam.
Yeah.
They could be going blind right as they're driving my Uber.
Yeah. And they have no
So
idea.
it's infinitely preventable, definitely treatable, but a leading cause of permanent blindness.
That's great. Great information. So my last question for you is, if you were going to give advice on 1 or 2 things that women need to do to advocate for themselves in a healthcare space, what would you tell them?
Well, be an advocate for starters, and that is be proactive about not postponing care. And once you get what you're in that provider's office, the doctor's office, make sure to have your list of questions and concerns there. Doctors now are being increasingly pushed to see more and more patients in a day, so that the time to be with your provider is shorter.
Yeah.
So be prepared with your questions, and then that's the easy part. But when you don't get an adequate answer, you ask it a different way, or you are persistent. This is your time with your physician or your provider, and don't let that opportunity go to waste. Be persistent in advocating for yourself.
Yeah. I love that. I couldn't agree more. I started my career in nonprofit work working for Susan G. Komen,
Yes.
and I watched women die because they didn't ask questions, or when they did, they were told, "Oh, you're too young." And I think it really shaped my work going forward. And so I absolutely agree. Ask the questions and keep asking them until you feel comfortable with the answers you've gotten and you know how to move forward.
Yeah, and if you don't think, if that answer doesn't sound right, see another provider, another physician, get a
Yeah.
second opinion.
Yeah. Yeah. Well, you've been great. I'm so appreciative of your time and your passion and your insight. So thank you so much for sharing it with us. And for anybody that wants any more information, you can always go to Prevent Blindness website. And thank you.
Thank you, Heather, for asking me. Great to see you again. Hope I see you face to face soon.
I hope so. Take care.
Thank you.